Good morning and welcome to COVID-19 Talk with local health authorities. We have with us our new doc, Dr. Maria Rivera, representing Harris County, Dr. David Persse, representing the City of Houston. This is sponsored by the Rotary Club of Houston. Thank you to past President Kathy Fenninger of the Rotary Club of Houston for providing these questions. I'm Stephen Williams, the Director of the Houston Health Department. Okay, we should have anticipated this first question. We're now past 7 to 10 day period since Texas opened. How are we doing?
Well, so looking at the numbers this morning, the Texas Medical Center numbers continue to drift down ever so slightly. The number of new cases seems to be fairly flat. Looking at the CETRAC data, the same thing. The number of new hospitalizations or total hospitalizations continues to drift down very slowly. So I would say we're not quite plateaued because we continue to drift down, but it's at an ever so gentle pace. That's what I would say.
Yeah, I completely agree. And I think the only thing is we're only 7 to 10 days out. Often we see impacts of things like that around 2 to 3 weeks out. So hopefully we'll continue the same trend.
And we haven't experienced the impact of spring break yet.
We have not. And Easter's coming up.
Oh, we keep our fingers crossed. CDC now says schools can permit students to be only 3 feet apart or 6 feet if numbers are high and while eating or singing. Also, no plexiglass is needed. What is a high number? Should schools follow CDC or local health authorities' guidance? If the latter, what is your guidance? Come on, tell the truth. What do you think we should really be doing?
Yeah, so right now we're kind of right at that border of high transmission versus not high transmission. If schools are going to follow the 3 feet guidance, they absolutely need to mask every single kid. It's true that you don't have to have the plexiglass barriers anymore, but it has to be 100% masked. And then the distance between teachers and students still has to be 6 feet. And so if there's going to be situations where the kids are not masked, like in the cafeteria, or if there's just, if they're too young and they're not keeping on their mask, then you still have to do the 6 feet apart. It has to be 100% mask. And we're still right at that cusp of whether or not we're really considered high transmission at this point.
Is 6 feet better?
6 feet is always the surer bet. So I think if you can do 6 feet, if you have the space to do 6 feet, then that's definitely something that you can do.
You know, let me say one thing. So that 6 foot comes from, like when adults cough, the droplets generally can go 5+ feet. So that's where the 6 foot. I don't know they've ever.
And I think that that's why, if you look at the CDC guidelines, they divide it for elementary school kids. 3 feet is probably fine, even in high transmission rates, but in middle school and high school kids, you really should stay 6 feet apart if the transmission rates are higher because they're practically adults. It's just kind of their size. And so I'm guessing, I don't know if they looked at little kids coughing and that's how they came up with 3 feet.
That'd be interesting.
But I'm assuming that tiny people cough a little bit. Maybe they don't go as far, but the middle school and high schoolers are, for the most part, adult-sized.
Okay, you've already answered this. What about teachers' distance to students? You said 6 feet.
Yep.
My company is looking at returning to in-person work. They said they cannot require everyone to get vaccinated since the vaccines are still emergency use. Also, we can ask for medical or religious waiver. Until we reach herd immunity, can't we refuse to return since it poses a direct threat to our health?
Well, I'll take that one. So I'm not an attorney. But when the emergency use authorizations came out, it was stated that employers couldn't mandate that. And I won't say who, but there is one employer in the Houston area who's gone to their attorneys and they said, yeah, they absolutely can. So I think that's a question for an attorney. I don't think I really know. I don't think we know the answer just yet.
Yep.
Is asymptomatic spread increasing?
I don't know that's increasing.
I don't know that it's increasing. It's probably about the same.
It depends on how you want to ask that question. So 40% of the people who are infected are asymptomatic. Now, I don't think that percentage has changed, even with the new variants. And I don't think it's changed. So if people who are vaccinated, less likely to become infected, but some will be infected and will be asymptomatic. I just don't know what percentage of that.
Right.
I don't think we have that number yet.
Right, and I know that if you're vaccinated and asymptomatic, you still are, we think, less likely to transmit it. So I think it's a big question mark.
If we do nothing at all, won't this virus just go away?
No. Even if we do everything, I don't think the virus is going to go away. I think we're way past the point. The question is how good of a job can we do to contain it to the point that we minimize death?
Yep, exactly.
So it's going to be with us.
Most likely.
And I said containment, wrong word, mitigate.
Dr. Dr. Fauci mentioned that those over age 65 are more apt to become reinfected. Did I hear that correctly?
I
I'm not
don't
sure
recall
I heard,
hearing that.
I don't remember
It would,
hearing that.
It would make some sense that as we get
Yeah.
older, our immune systems are not as resilient as they are when we're younger. So that would be a possibility, but I don't know if that's been shown yet.
But doesn't that really hinge on one's behavior?
Yeah, and also when you were infected. So if you were infected a year ago, then you are probably more likely to be reinfected now, at least for what we know about the antibodies. So.
The U.S. is looking a lot better than other countries now, and the numbers are on a good trajectory. If we continue to do what we have been doing, Texas seems to be a plateau, but not decreasing. You just said that.
Mm-hmm. Yeah.
And even if we plateaued where we are, that's not a good thing, is it?
Yeah, that's one thing to keep in mind is the plateau at this point, the number of patients, plateau being defined as the number of patients who are currently hospitalized, number of new cases per day. While it's plateaued, it's at a much higher number than it was the last time we plateaued.
Yep.
We are a hugging family. My kids have been protecting me, but now that I'm vaccinated, should they be concerned about themselves since they are not yet jabbed?
Yeah, so if you're already vaccinated, at least the recommendations right now so far, and it kind of also will depend a little bit on the behavior of the kids, the age of the kids, but for the most part, they are still at risk if they're not vaccinated. But if they're surrounded by vaccinated people, then the risk to them is lower. And so for the most part, the recommendation still is that you can still hug those family members as long as those family members are considered low risk for complications of COVID-19. Right.
You know, it seems like everybody is looking for a way to really just open up.
Yeah.
And I think they're looking at the nuances of the guidance that's coming out so that we can get back to what people perceive as our norm.
Yeah.
Along comes allergy season, and with it, coughing, headaches, runny nose, fatigue, and dust from the west to make things worse. I was told watery eyes was not a COVID symptom. How do I know if testing is needed?
So I would say that if people who have allergies, they know their allergies pretty well. They know when they're going to get it, and they're intimately familiar with their allergies. If you have anything that's different, I would get tested. Because this virus is, it's the master of disguise. It comes with all different kinds of symptoms. A couple of things that you can probably hang your head on a little bit more. Allergies tend to not cause fever. Allergies tend to not cause you to lose your sense of taste or smell. Those are things which are clearly we're seeing with it. But that having been said, this virus seems to be able to impact every single system in your body, from watery eyes to ringing in your ears to sore throat to skin rashes to GI problems. But you know your allergies. If you got something that seems a little bit different, I would get tested. That's what I would say.
Thank you for joining us with COVID-19 Talk with local health authorities. We'll be right back.
If you love concerts and live theater, going to baseball games, and eating in restaurants, inside, if you love parties and the small talk with the guy who makes you iced coffee the right way, then wear a mask and let's beat this virus so we can get back to the things we love. Mask up, America.
Hello, Houston. Now more than ever, communication with our neighbors is critical as we work together to prevent the spread of COVID-19. It's important to get updates about resources, testing, and safety practices. Sign up for Neighborhood Updates to receive automated voice and text messages in English and Spanish. This new resource is available for anyone interested in receiving messages without needing a smartphone or access to the internet, especially our seniors. To subscribe to Neighborhood Updates, call 311 today and enroll.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing the song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water, make sure that's okay. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
Welcome back to COVID-19 Talk with local health authorities. We had a question that came in over the break. If you test positive with the rapid test and negative with the PCR test, which result should you trust?
Yeah. So the rapid tests are notorious for having false negatives, not so much false positives. But anything's possible, and the PCR is pretty much considered to be the gold standard. So one question I always have is, how far apart were the two tests taken? And very often people get it like the next day. They'll go and get a confirmatory, so it's pretty prompt. Personally, I would err on the side of caution and assume that the positive was positive and protect my family. That's what I would do.
Yeah, and I think that we had this situation come up a couple of months ago, actually, and our data team was able to track it back to a certain lab that was having a lot of false positives, and they don't know exactly why, but there was like a group of kids that all tested positive on rapid and then all tested negative on PCR, and in that case, we decided this is probably a false positive. But if there isn't that specific link of back to a group that are all known to be probably false positives, and I totally agree with Dr. Persse. We usually just say if it's positive, because the timing is really important, and also just how you take the sample. Like sometimes even if the PCR tested for whatever reason, you kind of moved or didn't go deep enough, then it's possible. Especially if you have symptoms, you should definitely consider it a positive.
Okay, now we have it. Are babies immune if the mom receives a vaccine while pregnant? If so, for how long?
Yeah, so this is brand new data that's coming out. There's been a couple of preliminary studies that show that the babies do have antibodies if the mom was vaccinated during pregnancy, but we have no idea how long those last yet. And we don't know what level of protection they have. We just know that they can be measured in the baby's blood.
Okay. Arizona opened up vaccine to all over 16. Texas is opening to all over 18 next week with a priority for older or health compromised, I assume. How will this work? Are all sites prioritizing by age or just mega sites? Y'all always look at me when you want me to answer. At least between the city and the county, we are really prioritizing by age.
Yeah.
As a matter of fact, we are following the state's guidance that if someone over 80 walks up to go ahead and see them. We don't encourage that, say, like at NRG, but some of our other sites we would be able to accommodate that.
Can I add one thing? I think it's important that people understand the thought behind. So those that are older, the older you get, the more risk you have for having a really bad complication or dying. So that's why that's a priority. And the state has opened it up, and several states have opened it up. And one thing to keep in mind is it's like the 20 to 40-year-old age group where we're seeing most of the spread right now. And so by opening it up, if we can get those folks to go, we may be able to slow this thing down.
Yeah. And so it's a good thing that we're opening up,
Yeah.
so we can get some of those folks that are actually spreading it.
Yep.
People sign up for every vaccine list that is possible. Do we even know how many are trying to receive one? No. Well, actually, I know on the city side we have unduplicated some of the individuals that have signed up on our particular site, but we wouldn't have any visibility on whether or not they've signed up on other people's site.
Yeah, or CVS or the hospitals or the county, right?
I agree. I think often the county and the city, since we're doing NRG together, then some of those are unduplicated. We can have an idea, but CVS, Walgreens, HEB, all those other Methodists, we
No
just can't.
idea.
No idea, yeah.
If I am a young adult and happen to grab an opportunity, will I be bumped after getting an appointment? No.
No.
We won't bump you. We will accommodate you. I have recovered from COVID. What is the latest advice on how long to wait to get the vaccine? Every place I look has a different answer. Now, I don't know why they would have a different answer.
There are different answers.
Europe has a different opinion.
Yeah.
Oh, okay.
Yeah.
But they're not in Europe. They're over here.
That's right.
But even some people here have different, at least different physicians in the community may have different opinions.
So
Some people
what
are
if-
telling you to wait 90 days until after you've been infected. And a lot of that is mainly an ethical thing. They think that possibly if you've been infected, those 90 days you may be protected just from the antibodies you develop from being infected. And so you may want to leave the vaccine for others. Some think that you possibly will not have, they don't know how you will react to the vaccine if you'll develop the same amount of immunity. But for the most part, at least the guidance that we're giving, and I think the city's giving the same guidance, is just wait until you've completed your isolation period. So don't come when you have symptoms. Wait till you finish your isolation period, and then you can get the vaccine.
Yeah,
and
as long as you haven't received some certain treatments like convalescent plasma and monoclonal antibodies, and then you do have to wait a little bit.
And that isolation period is about how long?
It's about 10 days.
10 days.
About 10 days? Okay.
Yeah.
Well, it's not about 10. It's 10 days or until the resolution of your symptoms. Yeah.
Okay. That's what I'm used to hearing, not the 90 days.
Right.
If vaccinated, am I more or less apt to be asymptomatic if I catch the virus?
Well, so if you're vaccinated, you're more likely to not contract the illness, but you still can. And again, this goes back to that 40% asymptomatic, so we don't know. So can you be infected and asymptomatic after being vaccinated? Absolutely, yes. More or less likely, I don't know how to answer that, but can you be? Yes.
Agreed.
Stephen, both you and Mayor Turner said the vaccination goal is 70 to 80%. How do we stand now? Actually, I got that from Persse and all these doctors around me. How do we stand now? We're right about, what, 13% fully vaccinated?
So. Totally vaccinated.
Yeah.
Yep.
So we have a long way to go.
We have a long way to
We have a
go.
long way to go. What do we know about long-term impact for children and school athletes who catch the virus? This is related to long-haul issues and cardiac complications.
Yeah, I can take that one. What we know so far is that there is a subset of kids, and we don't exactly know why, that do have changes in their blood vessels, and so they and some changes in their heart. It still seems to be a really small number of kids, but even when they looked at just kids that were hospitalized for other reasons that happened to have had COVID at one point, they did show some of these markers. Again, we still think it's a really small group of the population, but we just don't know for the kids that never had any symptoms, never got tested, we just never saw. So it's something that is concerning enough for people to be looking into it, but I don't think it's anything that we need to be alarmed about because it still seems to be a really small group of kids.
Okay.
You agree, Persse?
Yep.
Okay. What's happening with homebound seniors and the disabled? Should they just stay home and avoid being near anyone? Well, if they're homebound, they are homebound, but we actually have a way to get them vaccinated. We actually have a contract where we will send someone out to vaccinate someone that is truly homebound. This is not an issue related to choice or convenience.
Yep.
Thank you for joining us for COVID-19 Talks with Local Health Authorities, sponsored by the Rotary Club of Houston. We'll be right back.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
I'm Carlos Correa.
I'm Slim Biles.
I'm Slim Thug. I recovered from COVID-19. Protect yourself, protect your loved ones, and mask up.
I want to encourage everybody to be a team player and mask up.
Mask up like a champ to protect yourself and everyone else.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like an all-star.
Wear it like a champ.
Wear it like a boss.
Remember, we're all in this together. Mask up, Houston.
We are in this together now. Now we have the tools to overcome this challenge. Social distance, wash your hands, get tested, and wear a mask. And we will. I have no doubts. Because I believe in we. Better together.
Welcome back to COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. Texas Children's Hospital diagnosed more than 10,000 cases of COVID. This seems high for a younger population. Are they getting it from adults?
When it's been looked at, it is more likely for kids to get it from adults than from other kids. But in general, and luckily, kids have still gotten it less than the proportion of kids. So for example, if there is 1 million kids in Harris County, and I think the number is lower, then we would expect a certain number of infections, and we have seen less than that number, which is great. But it's definitely something that people are continuing to look at.
I understand Texas Children's Hospital has a trial for children aged 12 plus. Do you know anything about when that will be finished?
Yeah, so it's not just Texas Children's, it's a nationwide trial. They've completed enrollment for both the Pfizer and the Moderna vaccines for kids 12 and up. And it's expected that in the next couple of months that will be approved. And they actually just started enrolling kids as young as 6 months as well. And that will take a little bit longer, closer to the fall, winter, potentially early next year.
Is there a higher hospitalization rate for young and unvaccinated because of variants?
Say that again? Is there a higher, what?
Is there a higher hospitalization rate for younger unvaccinated because of variants?
Not that we've seen so far.
Yeah, so we might talk about the Methodist folks. They are seeing an increase of younger people being admitted. But you got to remember, we've done a really good job, and the elder folks are becoming increasingly vaccinated. So like I said, there's that 20 to 40-year-old group that's where the virus is spreading now. So it's not a surprise that we may see more people in that age group being admitted, but that isn't necessarily because of variants, but it may be because, we're learning that we've got a lot of UK variant in our community now. So don't know exactly how to accurately answer that question, but we're watching.
Are infants more resilient?
So if you're less than 1, for all viruses and like all respiratory viruses, you're more likely to get sick. And so we're still seeing that with COVID-19. So the kids that are less than 1 of the little kids, they tend to do the worst. And so it depends what you define as young, but usually 12 months and older, they tend to do a little bit better.
How does multi-system inflammatory syndrome impact children?
Well, it's just what it says it is. It affects multiple organ systems.
Yep.
It's rare. But when kids get sick with it, they tend to get very sick and require hospitalization, oftentimes wind up in the ICU. In fact, I think it's about a third of the time they wind up in the ICU with it. And it can affect any organ system. It was initially sort of compared with the Kawasaki syndrome, Kawasaki disease, which is an autoimmune thing. It's not the same, but it's similar in that it affects multiple organ systems. It can make you very, very sick. Fortunately, it's rare.
Okay. My daughter is now afraid to take a vaccine because her friend said it causes fertility. She learned this from her friends on social media, of course. Please tell me how to calmly respond with believable data.
Yeah, this has come up a lot, actually. I think if you look at the number, if you look at the number of women that have been vaccinated, and even the number of women that were in the trials that didn't know or that were trying to get pregnant, that happened to get pregnant during the trials, people have still been able to get pregnant. And if you look at just the science, there's no physiological way that it could impact fertility in any way. People are still getting pregnant at the same rate. If you look at all the women of childbearing age that have gotten the vaccine, they still are able to get pregnant. And I think this is just an unfortunate rumor that definitely is prevalent in our community and is just scaring people.
And we have, seen people here get pregnant.
I did hear a report this morning that the number of pregnancies in the U.S. is down, but it's related to the pandemic and the economic impacts. People are choosing not to have kids because they're worried about their ability to have money.
Yeah.
That's been going on before the vaccine came out. So, those who are anti-vaxxers may use that to stir up some baseless rumors.
I suffer from tinnitus, and based on a recent tragic story, the vaccine could exacerbate this condition. Should I get the shot?
Well, I would recommend that you talk with your doctor. With anybody who's got sort of a medical situation, talk with your doctor first that you're worried about it. I would suspect that while that high-profile case, the suicide of the guy who owns Texas Roadhouse, from his profound tinnitus, is a rare situation, right? And so, but I would talk with your doctor first. But overall, for most folks, I wouldn't. You're still a great. Remember, you got a 1 in 50. If you get infected, you got about a 1 in 50 chance requiring hospitalization. If you're hospitalized, you got about 1 in 10 chance of dying. Your chances of having a problem with the vaccine are about 1 in 100,000. I'll take my chances with the vaccine any day.
Yeah,
Some
and we
doctors
also-
are questioning vaccine after getting COVID. You've responded to similar questions in the past, but things change so quickly, and even my doctor is not sure.
Their doctor's not sure if they want to get the vaccine? Is that
Yeah.
what they're saying?
After being infected,
After
right?
being infected.
We're still recommending it, and all the experts are still recommending it. Even if you've been infected, there's a possibility of getting reinfected, especially with the new variant, so definitely still get it.
Something I've thought about. If I've already received 2 shots, would there be a medical reason not to also get J&J as a 3rd shot just in case? I have to laugh at that because I did think about that.
I think that
We're not recommending.
We're not recommending that.
A family member received 1 Pfizer and 1 Moderna. The place you went to must have seen her card and yet didn't seem concerned. Don't distribution locations try to monitor that, or are they told to ignore which vaccine was first? No, we don't ignore it. But,
no, it's supposed to be consistent.
yeah. Are the variants both more contagious and more serious?
We know that
So
the
the-
variants are more contagious, and there is some indication that some of them may cause more severe illness, but that's something we're still looking at.
Is it accurate to say 40% of all Houston cases are a variant? Do we know that yet?
I don't think we know that yet, no.
The AstraZeneca trial was found to be 79% effective and 100% effective in preventing serious illness. It's low cost with simple storage needs and good for the poor and middle income countries. Is this the global vaccination savior, or recent scares about using outdated data for their trial a game changer? This morning they said they readjusted it to like 76%.
Yeah, yeah.
So, I heard a rumor that Baylor just finished a trial on how Pfizer is reacting to variants, and we may not need an additional shot. Have you heard anything yet?
There was a trial that I read that looked at basically in the test tube, if you will. They took the serum from people who have been vaccinated with Pfizer, and then they introduced mutant into it, and the antibodies, in the laboratory seemed to work pretty well. Now that's different from real life scenario, but so the early indications are that it looks promising.
Those 5 years old and above will be vaccinated before the end of 2021. We don't really know that yet, do we?
I think that's what the administration is, that's the goal, so to get everyone back in school safely, but I don't know that we can't predict that.
Fact or fiction? Only people over the age of 55 should receive the AstraZeneca vaccine because of blood clots.
Fiction.
Fiction.
Standard tests are not locating variants found in France. Heard on KHOU.
So that's new. That's the new French one, and that's it's true and it's not true. So you have to understand how the PCR test is done, and the PCR tests now have the ability to pick it up, but the way they were doing it before, they were missing some. Yeah, and that came because there was a cluster of people who clearly had COVID, and they tested, and they were all coming up negative. And then when they dug into it, they found that the PCR test was designed in such a way that it was missing it, but that has now been. There are ways to augment the PCR test so that they're picking it up now.
Thank you for joining us for COVID-19 Talk with local health authorities. Joining us from Harris County, Dr. Maria Rivera, Dr. David Persse, representing the City of Houston. Thank you to past President Kathy Fenninger of the Rotary Club of Houston, and I'm Stephen Williams, the Director of the Houston Health Department.